The title of this episode is If I Got Cancer Today, What Would Justin Do? WWJD. And this is my exact protocol of terrain and parasites. I'm a pharmacist by training. I'm not your doctor. This is not medical advice. This is a thought experiment, what I call WWJD. Now, this has no mockingness to religion. Apologize if you're offended. I guess I thought about it and I thought I could do WWJCD, but Justin Curnutt still applies there. And this is what I would do with my own body if cancer knocked on my door. And if you stay with me until the end, I'm going to share the exact cleanse and reset protocol I personally run every 6 months to stay in what I consider peak terrain mode. I call it my Q6M protocol. If you're in the pharmacy world at all, pharmacy technician following me, a pharmacist, that stands for every 6 month protocol, Q6M. And I've built a Cancer 2026 cheat sheet for it that I'll tell you how to get at the end. Now, here's how I think about cancer now. I've done a lot of digging into this, a lot of research into this. We've been told for many years that cancer is basically a genetic lightning strike. It just happens. It just happens to people. When you zoom out on global data, it looks vastly different. A huge chunk of cancer risk is tied to modifiable factors like smoking, alcohol consumption, infections, excess body fat, or your BMI, diet, inactivity, environmental exposures. Now, flip that around, and the rest is aging, genetics, and a little bit of we don't fully know. Within that modifiable chunk, about 1 in 6 cancers worldwide is driven by infections, things like viruses, bacteria, and parasites. In the United States, that infection slices maybe a little bit smaller than the rest of the world, but still incredibly real. So in my head, the equation looks like this. Part of cancer is terrain and exposures. Part of cancer is time and genetics. All of it is biology, not destiny. That's the frame I use for myself. Now, let's lay out the model I learned from coaches, my own doctor groups that were all actively investigating and researching. And when I say research, I don't mean Google searching, I mean digging into the studies, the PubMed research, and just keeping an eye on this industry in general. You don't have to buy it 100%. I don't care. But it changed the questions that I ask. Every year, I tend to ask better questions about cancer because I keep looking into it. In the doctor's worlds that I tend to be a part of, cancer is not the first domino. Okay, it's the last domino in a chain of chronic systemic inflammation. Would be the last domino in a chain of immunosuppression from chronic infections, things like parasites, viruses, or other bacteria. Or it could be the last domino in a chain of things like broken mitochondrial energy, things like low ATP. So your immune system is essentially too tired to fight. Now, those are three incredibly common pathways we dig down and research. And my dad and I had this debate the other day, and it's absolutely true. Your body is potentially creating malignant cells at every moment of the day. And a healthy immune system silently clears them out. A cancer shows up when that silent purge fails. When your body can't clear it fast enough, then cancer tends to rear its ugly head. Now, the doctors that I'm a part of also argue our system is world class at acute care, that our United States medical health care health care, we don't really care about health, but let's call it that, is number one in the world for acute care. Okay, my gallbladder needs to be removed. I have a infection that I need to take care of immediately. I need a heart bypass. But when it comes to chronic disease, it often manages decline instead of rebuilding terrain. That's just the fact of what we typically do here in the United States. Things like chemotherapy, radiation, big surgeries, they can absolutely be necessary. I agree. I say that. But they also hit cell turnover, more chances for mutations, chemos, radiology, things like that. Eh, Getting mammograms every 6 months from the time you're 40 on. I mean, the cell turnover is incredible, and you have more chances for mutations. Okay. Gut and the immune system. Okay. The terrain you rely on to fight is compromised with most of these first world healthcare solutions. Now, core principle is simple, at least according to the doctors and myself. Again, I'm a part of for research. Okay. Our core principle is simple. Number one, fix the terrain. Okay. Things like inflammation, infections, energy. If you fix the terrain, you give your biology a better shot at doing its job. Now, that's a lens to look through, not a guarantee. So we know the terrain is everything, but there is one specific hidden factor that destroys your terrain faster than anything else. And almost no oncologist is testing for it or talking about it. It's not stress and it's not sugar. It's the infection connection nobody wants to talk about. Click this video right here because we need to talk about parasites.